So some images were left in the surgery, so that we will be covering in this video. The first image shown is of Edson's test, and we have previously discussed in that previous video, third part. So we'll not be discussing, just see the image and remember Edson's test. The person is looking towards the extended arm. Then the Rules test is the person is in that position, like if someone is going to shoot you and you do hands up position, that is Rules test. Then is Halstead maneuver. Halstead maneuver, here the arm is going back. That is, arm is abducted and extended to 45-degree and externally rotate. Means the person is going holding the arm back and the pressure is applied on the arm. Downward traction. And turn the neck away from the affected side. While in the Edson, we were turning the neck towards the side, here away from the affected side. Note any changes in pulse. Halstead maneuver, also known as costoclavicular test. Then the next image we have is of Wright's test. The Wright's test, basically one arm is in the upward position. In the rules, both the arms were in the upward position, while here only one arm is in the upward position. Then next we have the lines, the visible lines or the lines on the skin, and what are they known and what is their cause. So we have three types of lines, three to four important types of line. First is Cressel's line. Cressel's line are anti-relaxed skin tension lines at the dorsum of the nose temporal region and at the lower lip, but similar at the Boggs line in other areas, and run perpendicular to muscle fiber action. So basically, for the Kressel line, first we need to know the Boggs line. Boggs line are typical relaxed skin tension lines present all over. Then in the neck, in the nose region, in the temporal region, and at the lower lip, we have additional lines which are not relaxed skin tension lines, and these are known as Krassel's line. Kressel is not relaxed. Boggs is relaxed. Then we have Langer's line. Langer's lines are virtual lines and these are found in corpse and are found on punching. And Cressel's line are due to muscular contraction, living organisms, visible lines equals to wrinkles. Boggs line are also found in living organism, but these are virtual lines. The lines of Cressel is equals to Boggs line plus additional wrinkle lines. Then we have Rubin's lines. Rubin's line are anti-relax skin tension lines, and these are described by using stamped white paper or fingerprint device. No need to remember Cox lines. Then we have Blaschko's line. Blaschko's line is basically the pattern which we see the skin and mucosal disorders. Like some disorders are following this line: incognitia pigmenti, Menkes syndrome, Conradi-Huntermann syndrome, then hypomelanosis of Ito, and lichen sclerosis, segmental vitiligo. Remember the important ones: segmental vitiligo, incontinentia pigmenti, and hypomelanosis. The Blaschko's line are not tension skin lines. Unlike Boggs or Langers or Cox, these are not tension. These are embryological development of the skin or embryological lines. So Blaschko's, Cressel's, and Boggs and Langer's line that are important. Then next we have the shapes of the crystals that are found in the renal stones. So the calcium oxalate stones. Calcium oxalate stones are bipyramidal or envelope shaped. The dihydrate stones basically are bipyramidal or envelope shaped. Then we have needle shaped crystals. These are found in bruchite stones. Then we have rhomboid or rosette shaped or irregular or multifaceted, means many shapes are there. Rosette shaped, rhomboid shape. These are found in uric acid crystals. Uric acid linked with the acidic urine. Then we have cystine. Cystine crystals, these are six-sided or hexagonal. Then we have calcium oxalate monohydrate. Dihydrate was enveloped shape of bipyramidal, while monohydrate is dumbbell shaped or hourglass shaped. Dumbbell or hourglass shaped. And these true white stones. True white stone will have coffin lid shaped crystals. The calcium, magnesium, aluminium phosphate stones, and these are seen in basic pH and linked with the UTI. Coffin lid shaped. So let's revise again the crystals. Monohydrate calcium oxalate monohydrate dumbbell or hourglass shaped. Then dihydrate is envelope or bipyramidal. Bruchite is needle shaped. Uric acid is rhomboid, rosette, multifaceted, irregular. Cystine is hexagonal. And coffin lid, true white. Then we have classical syndromes linked with the pancreatic secreting tumors. The first one is Vipoma. Vipoma is linked with Werner Morrison syndrome, also known as WDHA. W stands for watery diarrhea, and H stands for hypokalemia and achlorhydria. Watery diarrhea, hypokalemia, and achlorhydria. It is in Vipoma, also known as pancreatic cholera. Then we have glucagonoma, glucagon secreting tumor. The clinical syndrome is necrolytic migratory erythema, diabetes, weight loss, and cheilitis and DVT. Basically, skin disease will be there and it is highly sensitive to octreotide. Then next we have the linked with the gastrinoma. Linked with the gastrinoma, we have Saro's triangle, gastrinoma triangle, and the boundaries need to be remembered. It is defined by junction of the cystic duct and the junction of the cystic common bile duct. Cystic common bile duct junction. Then we have neck and body of pancreas junction. And then we have second and third part of duodenum junction. Second, third part of duodenum, cystic duct and common pancreatic, common bile duct, and the neck and body of pancreas, the 3 points. And the vast majority, that is 80% of the gastrinomas, will be lying within this triangle. Then we have Kasabak-Marett syndrome. Kasabak-Marett syndrome is linked with giant hemangioma. Hemangioma will lead to Kasabak-Marett syndrome. It is a DIC-like condition, and the giant hemangioma traps the platelets. Then we have insulinoma. In the insulinoma, we have Whipple's triad, that is hypoglycemia, decreased serum glucose, and the symptoms resolve with normal glucose. So insulinoma, Whipple's triad. Whipple surgery is for pancreatic cancer. Whipple's triad is for insulinoma. Kasabak-Marett syndrome, hemangioma. And Saro's triangle, gastrinoma. Glucagonoma, dermatitis, cheilitis. Vipoma, watery diarrhea, hypokalemia, and achlorhydria is linked with Vipoma, Werner Morrison syndrome. So that were all the images of the surgery summed up here. I hope you will find this images section useful. If you like my content, please do subscribe my channel and follow me for more updates. Thank you.